So I'm here with Dr. Gatta, 2008-2012 CCF Scholarship recipient, who is now working as a physician. And I've invited him here for a CCF Career Chat. And I'm so grateful that he's come all the way out here from Nashville.
Yeah.
And we're going to talk about his career, how he got there, and hopefully he'll have some advice for aspiring physicians as well. So, Dr. Gatta, what exactly is your position?
Yeah, so I work as a faculty physician at Vanderbilt University Hospital, which is in Nashville, Tennessee. And my day-to-day job, I do high-risk pregnancy care. So I care for women with any high-risk condition in pregnancy. I spend about 50% of my time doing that, and then about the other 50% of my time I'm doing research as well.
So what does a typical week look like for you?
Yeah. So it's a typical week. One day a week I'll have a clinic for women who are pregnant or who want to get pregnant, who have some high-risk condition. So that could be they have a heart, kidney, or liver transplant and are trying to get pregnant or want to get pregnant. That could be a woman who has substance use disorder, so might be on heroin and is pregnant. It could be any run-of-the-mill pregnancy that has a complication. And that could be something like they have triplets or they have cancer during pregnancy. So I have a clinic for those patients. And then one day a week I'm in what's called the fetal center. And the fetal center is in this big children's hospital, it's on the 9th floor. And there we have a bunch of ultrasounds and we do fetal diagnosis. So we kind of assess all pregnancies for the health of the baby, and time and time again there's a complication that develops. There we kind of coordinate fetal surgery, fetal therapy. Babies that have congenital heart disease, we might monitor them throughout the pregnancy. And then one day a week I'm on labor and delivery. This is when we schedule C-sections, complicated C-sections. I might round in the hospital on patients that were admitted with a pregnancy complication. Maybe they had bleeding during pregnancy, or their water broke very early, or they had very high blood pressure. And then the other 2 days I'm working with medical students, residents.
Wow.
I'm teaching, and I might be doing research.
Wow. So this is a high intensity environment. You're kind of always on. You're always.
Yeah.
Do you work a lot of hours per week, I'm guessing?
Yeah.
And was this something that you always envisioned yourself doing from the start when you were young? Did you always want to be a doctor?
Yeah.
Did you always want to go into this specific field?
That kind of came and went. I definitely wanted to play baseball for a good. I played third base, but I'm 5'7", so I don't think I would have made it very far.
Yeah.
Right, you got the height, but
You never know.
yeah. I that was the dream. But then I entered college, majoring in philosophy. I really enjoyed creative writing. I also enjoyed kind of humanism and the liberal arts. From philosophy, I picked up pre-med early on, and I credit the fact that my grandfather was a surgeon, and I could tell he was one of these characters that when he sat in an airplane, the person next to them just wanted to talk to him. He was one of those people that everyone looked up. When his funeral happened, it was such a big funeral, and I recognized he was a leader in his field. And there was something about him, and the most tangible thing was that he was a physician. And so I ended up pursuing pre-med, but by no means was it a straight shot from there. A pre-med to medical school to residency journey is a long one. But the decision to pursue that was largely bent around my grandfather
And his legacy and what that meant to you. And
Yep.
so I'm curious, did any of the philosophy or the liberal arts studies that you did that kind of have any crossover with the pre-med stuff? Or?
So directly, no.
Yeah.
And most people, if those who want to go into medical school will take pre-med and they'll do some biology course as well, or major or chemistry, but you don't need to major in biology or chemistry or any of the hard sciences. And I would encourage you not to.
Okay.
If your heart is kind of into kind of the right side of the brain stuff. I was one of those kids who in high school would take a book written by Immanuel Kant on the train and read that, and or I would take a book, I wanted to learn about string theory, and I wanted to learn about, I was really into kind of the origins of life and why we're here and natural history and Darwin. And so for me, putting that front and center as my major was important. I also had a very strong background in Catholic education, so I ended up going to a Jesuit school, and there kind of the Jesuit philosophy of, cura personalis, or care for the whole person, or their principle of men and women for others. These were all I felt kind of drawn to more in the interdisciplinary philosophy world.
And that crossed over with medicine too. I mean, care for the whole person, the mind as well as the body, and how you think about medicine as perhaps maybe going out on a limb, like not just explicitly a hard science, but more you assess everything and put it all together, perhaps.
That's absolutely right. I mean, I can sit in front of a patient and say, you need to do this, this, and this, and this, and this, and then next patient, you this, 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 and this. But if I don't have any connection with that patient, that whole counseling session that I just did with that patient's useless.
Right, they're not going to take your advice.
Right, and so part of humanism is connecting first with that patient. So the first 2 minutes of any patient encounter, I'm just giving that patient space to tell me what's on their mind. Right, and it could be, why they're there. It could be their mom is sick, or it could be the fact that they're moving, or the fact that they waited so long in the waiting room. And so part of this attention to humanism is something that was ingrained really early on by, kind of my traditional Catholic education, my family values, and then later honed in philosophy.
And reading Kant on the train to high school.
Right. It's my duty to care for that person. So.
Yeah.
Yep.
So where did you go to high school exactly?
Yep. So we're on 69th Street right now. I went to high school on 85th Street at Regis High School, which is one of the 4 Jesuit schools in New York.
Wow. Okay. And then from that high school, you then applied to college where?
Yeah, I kind of looked mostly northeast to college, and somehow ended up in Missouri. But I really wanted to have get out of college with as little debt as possible, and so I went to St. Louis University, who offered a full scholarship, and that was the initial reason. But it was so great to get out to the Midwest, and meet people from all across the country there, and they had a very strong pre-med and philosophy program.
Yeah, and it seems like, we were talking before this for the viewers back home, but Dr. Gatta as well also has traveled around kind of extensively in terms of his education and where he's been. And I'm curious if that ability to interact with kind of different fields of the population, different environments, and different, ways of thinking and being, if that also has kind of formed your view of taking care of people. Yeah,
I see, I'm one of the people that takes the subway from the airport to, where we are, and I think that, those basic interactions, those skills of being around people and getting to know people are something that translate very well when you're at a bedside.
Yeah, I would find important. You got to trust your doctor.
Yep.
You must trust your doctor and what they do. So, if you were to look back at high school, Dr. Gatta, well, not high school Mr. Gatta, maybe.
Luke in high school.
Luke in high school, yeah.
Still Luke, but yes, very much Luke.
What would you say to him? What advice would you have for maybe a prospective Luke or a prospective Dr. Gatta, looking out there, maybe entertaining thoughts of medicine, maybe not even entertaining thoughts of medicine?
It is so hard to know what you want to do, right? You're kind of pestered and badgered with these questions of what am I going to be in 10, 15 years? I think that those questions are impossible to answer. You just don't know what the world's going to look like or what your path's going to. There's 2 things I would say is, is the first thing is really get to know who you are. And what I mean by that is, what do you like reading? Where do you find your conversations going? What kind of gets you up? What do you want to share with people? What's on your library? Like, who are you? And the second thing I would say is, my life is dependent on people who have invested in me along the way. If you came to my office in Nashville, you wouldn't see my diplomas on the wall. You would see 13 people on the wall on a 5x7 card. They're pictures. That's because each one of those 13 people, at some point in my life, has said, like, this is, you're really good at this. Or I could see you going into this. And so I would say find a mentor from any walk of life that believes in you and that selflessly wants the best for you. They want to will the best for you. Because I remember someone saying, you are really good at surgery, right? And when I heard that, I thought, oh, maybe I can be a surgeon. Or even backtrack from that. I remember saying someone saying, you are really good at writing, right? So maybe I should pursue that. But finding people that believe in you along the way is so important.
Yeah, and there's a lot there that I want to touch on, even selfishly myself, because I get the chance to talk to you. But you speak about this thing of like, what do you like? Kind of who are you as being a touchstone? The old know thyself, obviously. But it's funny because I think that people, or people in general, it's kind of hard to start noticing who you are, if that makes sense.
Totally.
Like, it's kind of, so when did you kind of start to get, and you say, what you like, where your conversations naturally go, kind of your taste in things, but when did you kind of start to notice that you were coalescing a little bit?
That's a good question. I still think I'm figuring that part out, but I would say it was in high school. Right? I think I struggled in high school. I would say that in college, I began to learn what piqued my interest, right? I saw the leaders, I said, like, I want to be like that person. Maybe not that person, but have similar characteristics to that person. And so, I would say around college, I began to look up to a Jesuit priest named Father John Kavanaugh, who was a moral theologian and a philosopher. And
nice.
Now this is kind of like an older era. You would find him like kind of smoking on campus, and he'd be one of these people. But I really liked the way that he thought and reflected about the world. And I liked that he was somewhat of an introvert. And nothing that he said wasn't well thought out. And I thought, well, how can I get kind of that kind of brain?
Yeah.
And so I asked him, like, what are you reading? What's your bookshelf look like? And so kind of it was around college where I began to find mentors and seek out those people. And from Father Kavanaugh, I went to another person named Dr. David Wagner, who's still an emergency medicine physician, now retired, but I really attached to him and who he was. And then from Dr. David Wagner, I kind of found someone named Dr. Brenna Hughes, who I very much wanted to be like her and have her brain. And so even though you might not know who you are, I found it easier to kind of assess who I wanted to be by looking at people who I admired.
Yeah, and I feel like a key phrase that you just mentioned when you were talking about finding mentors or, looking for people that you look up to is that, you said seek out. You have to really, obviously you have to, these people have to be in your orbit somewhat, but I think the idea that you must seek out these people, you have to kind of jockey for it a little bit and be there and ask them, what are you reading? How did you get to where you were? I think that's really important because a lot of times, I think I too as well wish a mentor would drop out of the sky, but you have to really, find these figures that you like and kind of chase them a little bit.
That's exactly right. And I would ask them, like, point blank, how did you get to be where you are, right? Tell them, I want to be like that. I think that I'm now in a position where students are coming up to me and asking those questions, right? And I will say that it is so rewarding when someone comes to you and says, I like what you're doing, right? Like, I now am responsible to help that person, right?
Yeah.
So I would say that it's totally okay to email them. It's easy in medicine to find people's emails. And if you don't know, if you can't get in touch with that person, you probably are 1 or 2 degrees separation from that person, right?
Yeah.
Talking to your, school teacher, right? And saying, like, I want to, identify, I want to get to know that principal. I want to get to know this person. Can you help connect me? But my life is totally not self-made. Now, my motivation was self-made, but my life was something that was collaterally made in that, there's 13 people on my wall, and in reality there's way more than that, that, made me.
Yeah, that's a beautiful thing. And yeah, I mean, also because I'm interested in this Jesuit guy that you had on your college campus who was always sitting around, Father John. Sorry,
John Kavanaugh.
John Kavanaugh.
Yeah.
Okay, I remember the John part.
Yeah.
But because I also, to come back to this a little bit, but you're also, speaking about holistic care, looking at people, hearing them out, et cetera, and I think maybe the moral theology that you mentioned, that seems like it's on a pretty convergent track with those tenets as well,
Right. Yeah.
like an understanding.
The word convergent, good job, yeah. That's exactly it.
So you could email, bother your professors. This is a big one.
Start it there.
Yeah, bother your professors and was there did you ever have like a moment of doubt? Where you didn't know what you're doing?
Totally. I mean, doubt is every day you have.
Yeah.
But I would say I remember vividly my first Bio 104 exam, and I think I got like a 60 in it, right? Like, it wasn't good. And I was shocked by that. And it was a moment in which I was like, well, I'm probably not going to get an A in this class. I may be able to eke this up to a B, right? But that's just, how willing am I going to be to get to that point, right? And I studied my tail off. And the second test, I remember, this is back in the day of paper tests, you had to go pick up your paper test. And I remember I got an 86 on that. Yeah. And felt, you know what, I can do this, right? Yeah. I can achieve this. So, that was a kind of a tangible moment of doubt. But they don't stop. These kind of opportunities and doubts don't stop happening, into the present day. Yeah, it's something that you always probably have to contend with and think about, but stay the course. Yep. Would be good. Listen to what I'm hearing. Just know why you're doing it, right? Yeah. Viktor Frankl, he was a psychiatrist who was in Auschwitz. He wrote a book called Man's Search for Meaning, and his line in there was, man or woman can withstand any how as long as they have a why, right? So if you have a strong why, you can figure out how to do it, right? Now that why may change a little bit about time, but that should be something to continue to drive you to be the best possible self. That's beautiful. That's beautiful. Yeah. So, I mean, especially now, because it's, I mean, we were talking about doubt, but if you're doing these long surgeries, I mean, what does your thought process have to be like to be doing this kind of like high intensity, super high stakes? I mean, like delivering a child, making sure the child gets safely delivered. That's probably the highest stakes, one of them. But what do you how do you think? What do you do? Is there something that you prep for? How do you prep? I mean,
Drink a
So
certain
it
kind
takes
of coffee.
years and years of preparation.
Yeah.
I don't work, just like I'm not self-made, people help to make me. I don't do these surgeries alone, people help me.
Yeah.
Right? Now, I might be the leader in the operating room, but a leader is only as good as those who you're surrounded by. Just as an example, I remember my last surgical case at Duke. I was a fellow there. I did a lot of training. After 7 years, there was an emergency. The placenta wasn't coming out of the uterus. The baby was already out. The baby was already on her mother's chest. The family was bonding, and the placenta wasn't coming out, and there's just blood coming.
Yeah.
And in that moment, I knew that this person's life was at risk.
Yeah.
Right? This might be the last time she sees her baby.
Yeah.
You don't want to make a single dad, right? And I was able to look at the nurse, and she was able to read my look, and she knew to go out and get a new tray of instruments, which was for a hysterectomy, right? So I didn't have to say anything to her. She just saw my look. I stepped out briefly, and I talked to the patient about the emergency of the situation in kind of the most calm way I possibly could. And she saw the look in my eye that she knew that this was the right thing to do. And then I worked with the anesthesiologist, I worked with the resident across from me. It was this kind of approach that what the right thing to do was very clear, but now we had to get there together. So the nurse was getting the instrument tray. The anesthesiologist was preparing all the blood products available for transfusion. And then the most important person in the room, the patient, said, "We're ready. Right? This is what we have to do." So the idea that I walk into the operating room and do everything is just not true.
Yeah, I feel like that, people have that. I was just even thinking about this, like, that's like nurse, and then a scalpel appears,
Right.
and then you're, but the camera is solely on you. And
the nurses run my life. I mean, I am only as good as my relationship with people in that room. And there was a very good outcome from that case. And after that, right, like all of us came back together and said, and I went to each one and said, like, thank you for being there, right? Like, thank you for the opportunity to care for her. Thank you for getting the hysterectomy tray, right?
Yeah.
I feel like, when you're starting off in medicine and you're kind of making all these mistakes and there's oversight, but the two words you're always saying is, well, I'm sorry, because you always feel like you're a cog in the wheel and you're slowing things down. And then over time, you start going less from I'm sorry to thank you. So it's kind of being more gratitude for the privilege of being there.
Do you see people who are on the I'm sorry continuum right now?
I do, and it's somewhat endearing. I remember a medical student once passed out in the operating room. I could, she were doing a bunch of stuff, and I looked up, and the patient had kind of frozen. The medical student frozen, and sure enough, I asked the nurse to come behind her, and they caught her, and they brought her to the workroom. And I went into the workroom, and she was crying, and she was like, "I'm so sorry that happened," and I thanked her for being there. She was vulnerable to, and we moved on from that. And now she is a kind of phenomenal medical student, right? She went to a top residency program.
Wow.
And so, I actually find the words "I'm sorry" as a good opportunity to close the book and keep on moving forward.
Yeah, that's crazy. I mean, I really did want to hear when you told the story about her fainting, that she would eventually,
Yeah, she turned out okay.
Yeah. Cool. That's awesome. Yeah, I think it's, especially, I mean, just speaking from my position, like, it's hard to remember you can make mistakes. Like, it's okay that you actually have more time than you think you do to make mistakes. Yeah. Because sitting on this end, you're like, okay, like, everything high stakes, like, it all matters, right? And it does, but, it also matters that you screw up a little bit, or you go up and down, and you go through, and you take all these weird ways around, and it's not exactly linear.
I actually think patients would rather have an honest physician than a perfect physician, right?
What do you mean by that?
Yeah, so I think kind of we're entering this age of artificial. I think about this a lot, and this is kind of where the philosophy comes in.
Yeah.
We're entering this age of artificial intelligence where, you can probably get a lot of advice, and you may even at some point be able to get authentic medical advice from a machine.
Mm-hmm.
But I think that at the end of the day, if I am sick, let's say my life is on the line, let's say I'm dying of cancer,
Yeah.
right?
Yeah.
For me, if I'm like vomiting because of the chemotherapy and whatever, I would still want a human being to be next to me.
Yeah.
Right?
Yeah.
And what I mean by that is like a human being saying like, look, like, I'm sorry this is happening,
Mm-hmm.
right? Like, medicine can't fix everything,
Yeah.
right? We can't cure everything.
Mm-hmm.
But it doesn't mean we can't stop healing, right? We
Yeah.
can't work together. And so I do believe that, patients are drawn to people who are honest and sincere and that they want to care for them, they want to heal them.
Mm-hmm.
But, a perfect outcome may not be the way that we had imagined it.
Right. If there's anything else you want to talk about, please. I mean, I'm interested.
I'm trying to think of anything. I don't. First off, I do want to say that not everyone in medicine is doctors, right? And I want to acknowledge that there are many avenues of caring for patients, and that includes nurses, physical therapists, occupational therapists, nutrition and dietetics. I mean, there is a custodian named Earl who provides as much care as I do for patients.
Yeah.
And I know that because, when Earl goes in the morning to kind of help clean the restroom and clean the room, the patient room, sometimes he'll just say like, "Do you guys get some good sleep last night?" or whatever that is. And they're much more. They can be very honest with Earl. And one time Earl came up to me and said like, "I'm really worried about this patient in here."
Yeah.
And so I do think that, I read somewhere that for every one patient, there are 84 people involved with that patient's care in the hospital, right?
Yeah.
A doctor might just be one of them.
Yeah.
Right? But from, the people who are valeting your car at the beginning to the people who are checking you into the front desk, the phlebotomist getting your blood, there's so many avenues for caring that I don't think that you need to be a doctor to care for patients, or you need to be a nurse to care for patients. The world is different now.
Yeah.
In a good way.
Yeah. Takes a village.
It takes a village. Yeah. Good team.
Yeah.
So.
Well, Dr. Gatta, I'm
man.
so glad that, we had you here and you could give this amazing career chat about what you do, and I hope to see you soon. I hope we'll see you soon again.
Cool.
All right.
Thanks, buddy.
Yep. Thank you.
Yep.
All right. Nice. Good. I was thinking the whole time, I was like, please, God, let the care